Hey everybody, I'm Chase. I'm the epidemiologist here, and today I'm going to show you how to remove a tick from your body. So before I talk about how to remove a tick, there's a couple things that you definitely should not do. The first thing is to burn the tick. Using something like flames on a lighter or a match is not a great idea because first, you can burn your skin, and second of all, it really doesn't work very well. The next thing is to smother the tick, so don't wrap it in tape or cover it in petroleum jelly. Some people think that you can suffocate or drown the tick and then it will release itself from the body, but it usually doesn't work either. The final thing is to paint the tick. Painting the tick similarly just really isn't as effective as using a proper tick removal tool, and you're just going to make the tick stay on you for longer than it would have if you just removed it with some tweezers. So definitely don't do those three things. So ticks are usually found in wooded, grassy, brushy areas, just like this area here. So we've got two sponges here that we're going to be pretending are human skin where you might be bitten. And we can see here that this tick has definitely been lodged into the skin. And same thing with these two ticks here. Definitely have bitten the skin and have stuck and have began to feed. So removing a tick is actually pretty easy. All you need to do is use something like some tweezers that you have in our house, or we have these at the Bullitt County Health Department, these little tick removal devices. They're just little plastic tweezers, but they're nice because they've got a nice flat area so you can get that real close to your skin. And again, I want to first start by saying a couple things that you shouldn't do. So the first thing is to twist. You don't want to squeeze the tick and then twist it because you run the risk of basically leaving the mouthpieces in there or detaching the body from the head. You could also pop the tick and make it burst. Another thing is squeezing the tick. If you squeeze its body, you're going to increase the risk of some of the infectious fluids that are found in the tick to enter your body. So you definitely don't want to do that either. So some examples of what may happen if you do these things where you may twist or you may pull with uneven force is that when you pull the tick out of your body, you run the risk of removing the body from the head. So that might look something like this, where I'm not getting as close to the skin as I can. I'm actually grabbing up here, which you shouldn't do. And when I pull, the body comes off and the head remains in the skin. And another thing is, if you have a tick and you do everything right and you grab as close to the body as you can, you apply nice even pressure, you may pull it out and all of a sudden there's still mouthpieces in your skin. And here we can't really see them because they're very small, but if we have mouthpieces left in the skin, then just leave them there. Don't try and dig around your skin or, cause any injury to your body, because eventually the skin will just heal over time and those will come out just like a splinter. So you notice a tick on your body. What's the first step? The first step is always to make sure the area is clean. We don't want to have a dirty area before we remove the tick, because there's always the possibility when you're using the tweezers or even our removal devices that we have here, which are plastic, so the risk is a little bit lower. But if you use something like metal tweezers, there's always a possibility that you could scratch or scrape your skin, and you don't want it to get infected. So you want to make sure the area is clean before you start. So what we're going to do is just wash it just like we would. Remember that this is just supposed to be like skin, so it could be your arm, could be your leg. You might need to do it in the shower, but all you want to do is just get hot water just like normal and just wash it just like you normally would wash your hands. Be careful not to squeeze or burst the tick while you're washing it. You want to make sure you're gentle. But again, you just want to make sure the skin is nice and clean. So finally, let's talk about the proper way to remove a tick. Like I said, it's real easy, and the only thing is the tick may be a little bit more difficult to remove than you might think, because they really are attached in there. Their mouthpieces have lots of barbs on them that are going to keep them held into your skin real tight. But really all you need to do is just using something like this or some tweezers, get as close to your skin as possible and stay nice and flat. Squeeze your tick, not too hard though. You don't want to bust the body open or inject any fluids into your body. And then just pull with very even force, nice and slow, up until the tick comes out. And you can see here we've got the whole tick, we've got its head, we've got its mouthpieces, we've got the body, and we're now ready to dispose of the tick. So now that we've removed the tick, it's important that we properly dispose of it. There's a couple things you can do. First, you can drown it in alcohol and throw it away that way. You can put it in a plastic container and throw it away that way. Or you could wrap it in tape, which is what we're going to do today, and then throw it away. The important thing is we don't want to pop the tick. We don't want to squeeze it with our fingers and pop it that way. It's just really unsanitary to do it that way. But the reason we do the tape or the alcohol or a plastic container is we just want to make sure that the tick is dead and there's no way that it's going to come out of the trash can or reattach when we're trying to throw it away or anything like that. So like I said, we're just going to wrap it in tape. Making sure to get the whole body covered in the tape. That way, like I said, it can't move. Wrap it up in tape, and then we're good to just throw it away. Ideally, flush it down the toilet. So now we've removed the tick. We have a nice clean piece of skin now, no more tick left. There may be mouthpieces in there, like I said, just leave them there if they are. The skin will naturally heal. But again, what we want to make sure we do is clean the area with, once again, hot water and soap. So we've removed the tick, we've cleaned the skin, but if there was one tick on you, then it's likely that there's more ticks on you. So be sure to do a thorough check of your whole body. They like to stay in warm areas like the armpits, behind the knees, in your groin area. They like to hide, that way you can't find them while they feed. So now that we've done that, just make sure you do a complete check, and if you do find more ticks, just complete the same process. Additionally, after you remove your tick, if days or even weeks or even months later you start experiencing a fever or a rash and you remember that you had that tick bite, especially if the rash is in the spot where the tick was, you should definitely speak to your doctor about getting tested for tick-borne illness. Just because you removed the tick does not mean that your risk of tick-borne illness has disappeared. Sometimes symptoms can take weeks or months to appear. To reduce your chance of being bit by tick, the best thing you can do is to wear long clothing and also to wear insect repellent. So here at the health department, we do have these wipes. These are 30% DEET. And what we want to do with these is just apply them to any area that we think may be exposed to ticks. So oftentimes that'll be, like I mentioned, your knees, your ankles, especially when you're on a hike. Sometimes you can actually get lucky and you can find a tick before it's actually bit you. In that case, you can just wipe it off just like a normal bug. But if you do get bit, it's definitely important to remove it as fast as you can. The research is a little bit back and forth, but some studies have suggested that if you remove a tick within 24 to 36 hours, your risk of actually contracting a tick-borne illness drastically reduce. So be sure to always remove a tick as fast as you can. The best way to do that is just anytime you're done with outdoor activity or outdoor work, go inside, take a shower, and if you don't want to quite shower yet, just make sure you look over your whole body, especially in those warm, hidden areas, like I said, behind the knees, elbows, armpits, just to make sure there's no ticks. So that's how to remove a tick. Make sure you're staying vigilant on your own body. Make sure you always look for ticks because they're really, really important, especially in today. We're starting to see tick-borne illnesses all the time. So if you've got more questions about tick-borne illness or just about ticks in general, feel free to give me a call at 502-955-7837, and my direct extension is 2104. Thanks for watching.